Consider this. Why does a disease such as HIV/AIDS still carry a stigma in this modern age? In a world where information is at our fingertips, it's perplexing to understand why misconceptions about HIV/AIDS persist. Stereotypes and false beliefs about this disease continue to fuel fear and discrimination. One might wonder, why is this so? The answer lies in misinformation and a lack of proper education. Many people still hold on to outdated notions about HIV/AIDS, incorrectly associating it with certain behaviors, lifestyles, or groups. This not only perpetuates harmful stereotypes, but also creates barriers for those living with the disease. They may feel isolated, judged, and reluctant to seek the help they need. Misinformation can lead to widespread fear and misunderstanding. That's why it's imperative we break down these walls of misconception and replace them with accurate, comprehensive knowledge. Dispelling this stigma starts with understanding the facts about HIV/AIDS. Let's dive into the truth step by step and work together to eradicate this unnecessary and harmful stigma. HIV and AIDS are often used interchangeably, but are they the same? Let's delve into this. HIV, or human immunodeficiency virus, is a virus that targets the immune system, specifically a type of white blood cell called CD4 cells. These cells are vital in protecting our bodies against infections. Now, what happens when HIV isn't managed? Over time, the virus can destroy so many of these cells that the body can't fight off infections and diseases. When this happens, we say that HIV has progressed to AIDS, or acquired immunodeficiency syndrome. AIDS is the final stage of the HIV infection, and not everyone who has HIV advances to this stage. So to clarify, all people with AIDS have HIV, but not everyone with HIV has AIDS. Understanding these differences is crucial in combating the misinformation that surrounds HIV/AIDS. Scene script. How does HIV transmit, and more importantly, how can you keep yourself safe? HIV, or human immunodeficiency virus, can be transmitted in a few key ways. It can be passed on through unprotected sexual intercourse with an infected person, by sharing needles or syringes with someone who has HIV, or from an HIV-positive mother to her child during birth or breastfeeding. So, how can we prevent the transmission of this virus? It all starts with being aware and taking precautions. Use condoms during sexual activity to reduce the risk of transmission. Don't share needles or syringes under any circumstances. And if you're a woman who's pregnant and living with HIV, know that there are medical interventions available that can greatly reduce the risk of transmitting the virus to your baby. Preventing HIV transmission is possible with the right knowledge and practices. It's about knowing the facts, making informed decisions, and staying safe. Remember, your health and well-being are in your hands. What does it mean to live with HIV or AIDS in today's world? Today, it's a different story than it was decades ago. Thanks to advancements in medical treatments, people diagnosed with HIV can lead healthy, fulfilling lives. Early testing and diagnosis play a crucial role in managing the disease effectively. The sooner one knows their status, the sooner they can start treatment. Antiretroviral therapy, known as ART, has been a game changer. This treatment doesn't cure HIV, but it controls the virus and prevents its progression to AIDS. With consistent use, ART can help individuals maintain a near-normal lifespan, but treatment is only one aspect. Mental health support is equally vital. Living with HIV can be emotionally challenging, but with the right support, these challenges can be overcome. And let's not forget the importance of dispelling stigma, which can often be a bigger obstacle than the disease itself. Living with HIV/AIDS is not the end, and with proper care and treatment, individuals can lead a fulfilling life.